Okay, we're starting. Okay, welcome to this webinar with Douglas Turkington and me. My name is Christine Rom. I'm head of the Early Intervention and the in Psychosis Advisory Unit for Southeast Norway, and then associate professor at the University of Oslo. And at the moment, we are working with a project trying to offer remote family therapy during the COVID crisis. We are offering a program called React North, which is a web-based program developed in Lancaster by the research group led by Fiona Loban. Obviously, this program has no section about the COVID crisis. So we have been so lucky to get some help from Professor Douglas Turkington to help us cope with the crisis and help relatives cope with the crisis. And Douglas Turkington, you are a professor of psychosocial psychiatry at Newcastle University. You're one of the major contributors to the development of cognitive behavioral therapy in schizophrenia and other psychosis. And I have to, is it like this, to show this book, which is almost a Bible for people who really like doing cognitive therapy for psychosis. And you have published several books, and you have also included a manual describing how to include compassion-based therapy and mindfulness into CBT for psychosis. And I think this is a time to be very compassionate about ourselves and others. And during the COVID crisis, you have also supervised family therapists both home and abroad. And in this webinar, you will share some of your knowledge and some of your thoughts about how we can help each other in times like this. So I was to say the floor is yours, but the time is yours. Yes.
So thank you very much, Kristen. Yes, I've supervised family members in California and also in Washington State in the city of Seattle. So I've got quite a lot of experience of working with families, and I've written 2 books for family members living with a loved one with schizophrenia, and they're called Back to Life and Back to Life number 2, which is not a very original title, but that they're easy to read books which back up some of the content of the teaching that your group are giving and that will be on this webinar. So I'm going to share my screen. So this webinar is about the issues that families face when they're trying to live through what is a time of big lifestyle change. Currently, we're dealing with the anxieties around potential infection with coronavirus and also the problems of lockdown. It's a time of uncertainty. It's a time that none of us have ever been through before. Now, cognitive behavioral therapy is a very useful approach whenever there's a big change that we have to deal with, because we probably have to adapt our thinking and our behavior to the new situation. So I'm hoping that this webinar will give some nuggets of information, some ideas that family members will be able to use in working with, living with their loved one with schizophrenia. So, what are the main emotions that might arise? Certainly in the early stages of the pandemic, there was a lot of anxiety about. And that anxiety was palpable. And it was about how dangerous is the virus? How many people will be killed by it? What are its symptoms? How can we detect it? So almost all of us, I think, had an increase in anxiety. But for some people, although we are learning more about the virus, that anxiety level has stayed high. Now, it's certainly clear that in a family with a loved one with schizophrenia, if there is anxiety increased, that will probably knock on to worsen paranoia and voices, and also to some degree to the whole milieu within the family. So it's important to recognize if we're more anxious. And we can recognize it because you can feel it physically. You might feel butterflies in the stomach. You might feel palpitations. You might feel tense and headachy, or you might be worrying a lot. So we need to recognize that emotion if it's there, and recognize it in ourselves and in our loved one. Now, sadness was more something that emerged with the lockdown. So when there was lockdown and social distancing, people started to feel isolated and they had loss of their normal activities, their work, their hobbies. We had a loss of many aspects of life. And when you're starting to think that you've lost things, you often become sad. Now, sadness in particular worsens the negative symptoms of schizophrenia. So it's very important to detect any sadness in the family and work with that together. So very much the first stage of using CBT in a family setting is to detect the key emotions. And that's not always that easy, but time should be spent trying to work out what emotions we're feeling. Anger, there's been a lot of anger about. I'm sure you've all seen it in the media. There is anger from one political party towards another. There's anger against the people who are being blamed for the virus. So again, anger almost always worsens voice hearing and worsens paranoia. Anger can be quite a destructive emotion. And when anger emerges in the family, what we really need to try and work with that so that it doesn't disrupt relationships and make things very unpleasant. Now, with loss of activities and hobbies, boredom became a major feature. And boredom is often linked with sadness. So the more you think you've lost things, the less you do things and hit your targets, the more bored you become. Boredom is again bad for negative symptoms. Is there much guilt about? A lot of people are blaming themselves for something that just isn't their fault. People are thinking to themselves, maybe I've done something wrong here. Maybe I should be punished for doing something wrong. It doesn't make sense because the pandemic's nothing to do with them. But some people blame themselves, and guilt is again linked to sadness. Now, the emotion of envy again is present because a number of people are locked down in quite cramped housing where there's not much space and room. It's difficult to access fresh air. So people who are locked down in that situation can become envious of people in bigger houses with big gardens, or like me, I live at the coast, not far from the beach. So the emotion of envy is again a very destructive emotion. So we need to identify them. So linked with the emotions, once we spot them, we then need to find the behaviors which are linked to this. And if we think about social media, a lot of us and a lot of the loved ones with schizophrenia might be checking far too often. And almost everything that you look at in social media is about the virus, about the risk, about the losses, about the anger. So whenever these checking behaviors are happening, they're actually worsening and heightening these dysfunctional emotions that people have. So it would be really useful to try and limit the checking of social media, maybe just to once a day to one reputable source. I don't know what that is in Norway, but for me, I normally just look at the BBC once a day, and that's the only time I check in with what the media are saying about it. If you were checking in more often than that, and you were already paranoid, that this could fuel your paranoid beliefs. So important to try and limit checking into social media. Now, worry and rumination are mental behaviors, and they're things that we try to do to keep ourselves safe. We think that the more we worry, the more we'll find a solution and we'll be able to make ourselves safe. But worry just drives anxiety, and rumination drives depression and anger. So we don't want lots of things buzzing round in the mind all the time. And to do this, we actually set a time each day when we're going to have a time to worry or a time to ruminate. So if you have a family member who is continually ruminating that somebody in the government has caused this virus, we ask them to try and delay that rumination until a certain time each day, maybe 6 o'clock in the evening, 6 till 10 past 6. That's the time we'll get together and ruminate or worry about what's happening. After 10 past 6, that's it over. So we give it a period of time to think about it, and then we try to use the rest of the day for perhaps more constructive activities. Now, thought suppression is another behavior of trying to force thoughts out of the mind. And we know that if we try to force thoughts away, they come back stronger. So if you find your loved ones getting very upset about something, it may be that they're very frightened about a thought they're having, they're pushing it out of their mind. They probably need to talk to you about that if they possibly can, rather than to suppress it. A lot of people have simply stagnated in the face of boredom and depression. They've just stopped doing things altogether. Now, obviously, that is a very unhelpful approach, and it's crucial to get out of stagnation and into activity. So if you're spotting any of these emotions linked to the kind of behaviors we're mentioning here, this is really a very good challenge for a family member to think about how they might help their loved one in this situation with their feelings, their thoughts, and their behaviors. Now, obviously, the more you get stagnated and bored, this increases fatigue. But we also know that the virus itself can cause fatigue. So it seems to be one of these viruses that can cause post-viral fatigue syndrome. So sometimes the fatigue might be caused by the virus. So we need to kind of work out what's going on here. But often the fatigue is caused by boredom and sadness, and it will be worsening negative symptoms. Now, some people are getting involved in addictive behaviors. certainly clear that eating has increased. Not that that's necessarily addictive, we've got to eat to live, but some people, instead of taking a bit more exercise, are just going via the fridge all the time. And the quarantine 15 is the 15-pound or kilogram increase in weight, which might arise if this isn't addressed. Other addictive behaviours, alcohol has been dramatically increased. Despite the fact that the public houses are closed, people are buying in alcohol and drinking it at home. So there's more alcohol being drunk. And with sporting events being cancelled, there's been a lot of gambling in other areas. So gambling on poker and online casinos. So a lot of these addictive behaviours have increased. So ideally, we want to work with the cognitive behavioural therapy, find out our feelings, identify the thoughts we have around our feelings and behaviours, and then hopefully try to adapt, perhaps a bit better, to this new situation of the lockdown and the virus. So we need to find our automatic thoughts. We need to catch them. And this is the very heart of cognitive behavioral therapy. Because we know that these automatic thoughts are never challenged and they run just below the surface of the mind. So the kind of things that you catch yourself thinking rather than you use your intellect to work something through. So you might find yourself looking at the news one day and thinking, this is a disaster. I can't cope with this. This country will fall to bits. There's going to be riots. There'll be violence in the street. We're going to have a big recession. Everyone's going to go bankrupt. Now, these are all classical automatic thoughts. They are very frightening and they're very catastrophic. And when we can make these more realistic, our anxiety should start to reduce. And I mentioned right at the start that reducing anxiety was really one of the things we were trying to do. Then there are the thoughts of anger. South China, the communists are to blame for this. Something's got to be done. Someone's got to pay for this virus. Now, these thoughts, if they run in your mind, are linked to anger. And anger is an emotion we mentioned, which is not all that helpful. Then we have a more worrying thought, perhaps, and this is the thought that things are hopeless. There is no light at the end of the tunnel. We can't get through this. And as I say that, I feel myself giving up. And this is the automatic thought linked to the beginnings of suicidal thinking. So if you're working on your automatic thoughts and talking to your loved one and you find them saying things like that, we should always say, thanks so much for telling me how desperate this feels for you just now. And maybe we should get one of the experts to assess the risk at this point, because we need to be aware of the risk of self-harm. Then we've got thoughts of envy. I don't deserve this. Other people are getting it easy. Some people are up in their cabin in the mountains. They're not socially isolating. So these are envious thoughts. And then I must have done something wrong, the thought of guilt. So we need to catch our thoughts and then we need to do something with them. And this is what the great expert of cognitive therapy, Aaron Beck, taught people about depression. If you can catch these thoughts and you work to change them, your depression will lift. And that turned out to be a revolution in psychological treatment. So let's think about these automatic thoughts again, just below the surface of the mind. It might be something like, oh, my loved one, he's doing nothing today. He's being difficult. A thought below the surface of the mind, which is driving frustration, are illogical. Now, what we find with these automatic thoughts is that they are not accurate. It's rare for people to think thoughts that are actually logical and true. So these automatic thoughts aren't based on fact. So once we catch these thoughts, for example, the thought, there will be riots on the street, we need to say to ourselves, well, that hasn't actually happened. I've not seen evidence of that. And in actual fact, the community has pulled together really well. So we need to challenge the thoughts that aren't logical. They are distorted. And many of the thoughts that we mentioned earlier are catastrophic. They make a mountain out of a molehill. They're just too extreme. So by repeatedly reminding ourselves that the thoughts aren't right, we start to become more relaxed. Emotional reasoning is an example of I feel an emotion and therefore there must be a reason for it. So I'm feeling angry, there must be something that has gone wrong. Someone must be to blame. So that's kind of circular reasoning. These kind of thoughts, everybody has them. We all have them all the time. They come from our childhood. We've had them for years, and they very much drive the type of person that we are. Are we somebody who's confident and balanced? These kind of thoughts are underlying it. Are we someone who tends to worry and be anxious? It's these thoughts that are underneath it. Now, these automatic thoughts, they can be detected. We can get a little diary and write them down, and we can work with them. And this is Professor Beck's great contribution to make psychological treatment more scientific. So as we work with these automatic thoughts, we come up with more reasonable responses. And we need to keep practicing with these rational responses so that they settle into the mind. So for someone who's being very anxious about the virus, we could be saying at least 95% of people survive the virus. Now the figure is probably higher, that's probably the worst estimate, but this virus is not highly lethal. 95 to 98% of people survive it. And that is a relaxing, rational response. Most infections are mild. That's true. I am a resilient person. This will make me stronger. It doesn't feel easy just now. The whole community is involved in this, but I am basically resilient. People will pull together. There will be compassion and heroism. Now, I think that is a really important automatic thought. When you are thinking in a very negative way or a very anxious way, this thought seems to be a really good antidote. The community can overcome this. And we've seen many examples of great compassion and heroism. The economy will bounce back. Will it be stronger? I don't know, but it'll certainly bounce back. It's taken a hit just now. So that's a useful, rational response. And in terms of all this divided politics, maybe very selfish political ideas won't survive this, because there is more compassion and a greater appreciation of the need to help each other just now. So maybe that's something good that might come out of this. The very selfish politics that we see in some places in the world might not survive this. If this virus did come out of the south of China, then we need to own up to that and see what we can do to prevent it from happening again. And maybe there are examples of things we need to do to prevent things from happening. For example, in the UK, we had a mad cow disease, which came from this country. So I don't think we can blame too much other countries, but we certainly need to be better prepared for next time. A good rational response for the apathy and boredom situation is, I can and will make my contribution, whether that be walking a neighbour's dog or taking some food to an elderly neighbour or someone who is in quarantine. This will pass. We're not stuck with this. Like a cloud across the sky, this time of difficulty and sadness and anxiety, it will pass. That's an important rational response. Some countries are starting to get back to normal now. Italy are doing it, Spain are doing it, and Norway are starting to do it. So we are coming out of this. That lifts the mood as we think that thought. And we're all in the same position. We're all in the same boat. This isn't my fault. It's not any particular person's fault. We will come through it as a society, and we will be the stronger for it. So these are the kind of rational responses which might be really useful. You could record them on a loved one's mobile phone and have them listen to it 3 or 4 times a day. It certainly won't do them any harm, but it depends what their own automatic thoughts are, what the correct rational responses are. But I would think that the ones I've listed here wouldn't do anyone any harm to work with these. Now, sometimes we use a coping card where you would write these on a card, keep it in your pocket or your purse, and just look at it and read the contents 3 or 4 times a day. Now, imagery is very, very useful. And some people don't really think in words, they think in pictures. They have images in their head. And these are 3 that I found useful in terms of working with the coronavirus crisis. So the first one, the sun is breaking through the trees there. It's a light at the end of the tunnel. We will get to that light. We will get through this. And having that image in your mind and going back to it and maybe basking in the feel of that sunshine as you get towards the sun there at the end of the tunnel, it's a useful image to lift your mood as an antidote to hopelessness. The next image I found very useful, and this is just simply a door. I don't know why they built this door beside a lake, because there's no building around it. But I took a picture of it because I thought it was a great symbol. And for me, this symbol is, I can walk through this door and do something completely different. So it is an opportunity during the 3 months or so that we have this lockdown, isolation, to declare this as a sabbatical and to actually do something I've always wanted to do. So this is a time of opportunity. And then what I decided to do when I walked through this door was to start writing a little diary of my earliest years of life. And that was from the time of my birth up to 5 years. I didn't actually know too much about that time of my life, but I was able to start gathering information together, getting old photographs, and really get a feel for my early life. Now, if you're thinking about something like that, that is a very therapeutic thing to do. You can start to really get a, a perspective on the person that you are now, and you can work out how you came to have some of the feelings and attitudes that you have. So that was very useful. I mean, for a loved one to start to look at their early life and think about where the family has come from, the good times they've had, the tough times they've had, that time they get bullied at school, whatever it might be, to actually look at that together as a family and talk about that is very therapeutic. So the image of the open door is useful. Now, the third image is, and this is the same lake, by the way, is just of a chair sitting there. And having been somebody who has had a multiple choice diary and just working flat out from one week to the next, never really achieving any of my targets because I had too many targets, working under stress all the time, I thought, well, I could just slow down. I could move from fifth gear into third gear. I could slow my pace a bit. And that's been a useful image. So you've got to work out for you, for your family, for your loved one, is there an image that would be useful? And maybe things might be coming to you as you're listening to this, but it could be discussed and worked on together. So what kind of behaviors help us? We've spoken about feelings, thoughts, and images in relation to the COVID crisis. Well, to get through any lockdown or quarantine, the first two items in this list are utterly crucial. We need to establish a routine so that our body and mind can establish itself in a new pattern. And this would be things like times to go to sleep, time to awaken, times to have food, times to exercise. So you get into that routine. And the other bit of routine is creativity. To deal with being locked down, you need to activate your creativity. And I've seen a number of my patients starting to paint, and maybe family members helping them get organized to start to paint again. Some people write poems, other people doing a variety of creative sort of activities. I had one client who was drawing cartoons from the television and discovered that she was actually very good at drawing these cartoons and then started to colour them in. They were finding new bits of creativity. Now, in terms of recovery from schizophrenia, these two things are crucial, that we get into a routine and we have an element of creativity there. These two things help the brain start to recover. We've mentioned reducing worry and rumination because these take a lot of mental effort, tire you out, and aren't productive. Exercise periods, absolutely crucial. I don't know what your loved one's going to agree to do during the lockdown, but I've had one chap who walked his neighbour's dog. This was an old gentleman next door who couldn't leave his house to walk the dog, and a loved one took the dog for the walk, started to like the dog and get to know the dog, and that was like pet therapy. That was a dog therapy. It was very useful. So we've got to somehow get some exercise in place. Meditation is usually helpful for the mind. A number of therapies use mindfulness meditation, and there's many apps you can get to do little bits of mindfulness. These are normally useful things for a loved one to do, and again, can be a part of recovery, but I do advise not doing meditation for too long, maybe just like 10-minute slots of meditation rather than too much introspection. Keeping practicing with rational responses and positive images and compassionate techniques. Compassionate techniques might be of using an image of, for example, a grandparent that they were very close to, and feeling them and hearing them saying positive things to them, which maybe they once heard during childhood. They could try to write a compassionate letter to themselves or use compassionate self-talk. These things are all useful. So we mentioned creativity as being key. A number of my patients who have recovered through creativity, because creativity brings so many other things with it. Creativity focuses the mind, it equalizes the activity in the hemispheres, it often brings them into a social situation where they can share a poem or a painting, other people will comment on it, and there is then an increased socialization. I had one of my patients who got so good that his art was taken for an exhibition that toured the country. So within schizophrenia, there are lots of latent creative abilities. And sometimes they're surprising. Sometimes you don't quite expect that they're there, and it's worthwhile looking for them. So I certainly found it creative to start to write my own story. That was a creative endeavor. Learn a few phrases from another language. Did your loved one have an interest in Spanish or Greek? Learn a few phrases. That is a very healing effect on the cortex. So maybe not learn a full language, that's a tall order, but a family could start to say a few phrases in Spanish to each other if that was a subject of interest. This painting was copied by someone that I know and done an absolutely wonderful job. This was their first effort. Some people just have talent. I couldn't have done that. Many of us used to play an instrument and have given up. Many of our loved ones have given up with a guitar or some instrument they used to enjoy. Let's get it down out the attic. Let's get it tuned up and help them to start to play some chords again. That is a very powerful way of filling the day with creativity and recovering. So, problems and CBT solutions for us and for our loved ones. Well, if there is increased anxiety, then the loved one who might be at home locked in with us or might be remote are probably going to be a bit more paranoid. And so we have a shared problem there. The family's a bit more anxious, the loved one's a bit more anxious and a bit more paranoid. So what we can do there is share the problem of how to work with anxiety. We do it together as a family, and we might say, hey, we're actually all anxious just now. This virus is frightening us all. So how about we have a video session once a day where we do a little bit of relaxation together, or try and do a bit of yoga, or maybe just discuss the anxieties we have and whether they're real or whether they're not. It should be said that perhaps if we're going to talk about something very sensitive, maybe it shouldn't be via Zoom or Skype. It should be through a more secure medium, maybe using a telephone call. If you've got a loved one with negative symptoms, and many do, low motivation, reduced self-care, then we can certainly share our problems with boredom and a bit of fatigue and a bit of lethargy, which is brought on by the lockdown, by quarantine. And we can say, hey, it's hard just now, isn't it? It's difficult for me to get anything done. I'm really feeling run down. How are you feeling just now? And in sharing that feeling of low motivation comes the beginnings of starting to find out what might be enjoyable together and what very small targets we might try to hit together as we start to improve. So we could share our negative symptoms. Voices in this kind of situation are tending to be more active. And what we can share there, I mean, I don't know if your loved one's going to be happy to write their voices down, but I think that's a very useful thing to do. But if they could write down a page of the kind of things their voices are saying, we could share a page of the kind of thoughts we have and compare them. And yes, the voices are normally more extreme, but the same sorts of themes are present in voices as there are in normal thoughts. And this can really help normalize the voice hearing, and perhaps by working on the themes, make it a shared issue, and voices can become less stressful by doing that. It must be said that all these ideas I'm putting out today need to be backed up by supervision, preferably with your loved one having a therapist or a family therapist. So some other tips for translating all the things I've just been saying into what you have to do in your relationship with your loved one with schizophrenia. We should say, yeah, I'm upset too. I'm upset by coronavirus. I felt sad, I felt anxious, I felt angry, whatever it is that you felt in relation to the uncertainty. We should acknowledge uncertainty makes us all struggle a bit, and share that so that they don't feel this heightening of the psychosis and of the emotions is just about them. Uncertainty is difficult for almost all of us to tolerate. Emotions can feel frightening, especially when they're mixed in with psychological, psychotic symptoms. So when we see paranoia linked with anger, when we see voice hearing linked to increased anxiety, that emotion should still be validated and it can still be worked with. So we can say, you seem to be really upset about what's happening in the television today. I can hear you've been talking about the government. How are you actually feeling about that? So is it anxiety? Is it anger? Is it something else? And it's said about how much of what is being said here is actually true and how much of it is fake. I've got to reassure you, I'm worried too. There's lots of stuff out there that I can show you which shows that there does seem to be some reality around this virus. There's a couple of people in our street who I know have the coronavirus and they can't leave their house. So it seems there's There's a very real basis to this. And there have been pandemics before in the past. There was the Spanish flu, and they come around every now and again. So we validate the emotion, and then we turn to the evidence to try and help the emotion start to settle a bit and to help the increase in the paranoia. Now, there are times when emotions are meant to be really painful and really, really high. And these are times like grief. So if there has been a death of somebody that was close to your loved one, close to the family, then you're meant to feel despair. You're meant to feel denial and shock. It's a very painful emotional experience. And if you don't go through that and get to the point of acceptance, then that is unhelpful. So in grief, we want to say, yes, we all grieve together to get over this. And we can work with the emotions linked to paranoia and fear, but the ones with paranoia and fear, we want to try and reduce them slightly. We mentioned worry time earlier on, a 10-minute slot for worrying in. This has been shown to be useful for people with paranoia, so that is a recommended technique. Acceptance that it's just okay to feel really rough at times, and to talk about it. And to understand that although you have an urge or a strong thought in the mind, that doesn't mean to say you need to act on them. That urge or thought can just be there. And I mean, a life spent purely in anxiety misses out a lot of other emotions, positive emotions like pleasure, joy, peace, lots of other emotions which might be accessed, for example, through an approach like mindfulness. I think it is important to adjust the filters in the family. If we possibly can, if they're at home, it's easier to do this so that they're not repeatedly looking at a variety of very frightening news reports or checking into conspiracy websites. And the worst one we've had was the issue of 5G and the coronavirus. There was a conspiracy going around that the 5G pylons, which were being built around the country, were in some way a cause of coronavirus. Some people got this entangled in with their paranoia and were starting to attack the pylons, which was affecting communication. So conspiracy theories aren't particularly useful at this point in time. Share useful sources. That's a very appropriate thing to do. Reduce exposure to unhelpful sources. Look for news that is more positive. There's a lot more going on in the world that is worth reporting on. And there's various media that deliver a more balanced approach. Now, another thing I want to mention is something that can really help recovery is altruism. And the family can work together towards an altruistic approach. So if you look at group therapy, people with schizophrenia treated in group cognitive behavioral therapy, the ones that really do well and start to recover are the people in the group who start to help other people. They start to talk to other people about their voices and their paranoia, and they start to help them with coping strategies, maybe try to organize a trip out for them. Once they get into that way of helping others, that lifts you out of the paralysis of your own psychosis. And there's lots of opportunities for this just now. And some of these are listed at the bottom of this slide. So sending positive messages to healthcare workers, if you know a nurse or someone who's working in the hospital, send them messages, supporting them. Your loved one could start to do that and start to get interested in doing that kind of thing. People in care homes are obviously really struggling just now, and writing little postcards, sending them messages is altruistic. Posting things online, this is the kind of thing they can do. Making some masks, I've heard of people doing that. I've certainly seen people out doing neighbours' gardens, and that is a very viable first step. Getting little food parcels for people. If you're a spiritual person, doing prayers for other people, or trying to gather funds for people. There's lots of altruistic potential here. So I think we're seeing through this webinar a number of ways that we could actually use the crisis to actually set a recovery trajectory. It's not easy, but cognitive behavioral therapies always trying to look for the positive in any situation. If your loved one is remote from you, I think that's in many ways more difficult. And we need to keep regular contact, Skype, Zoom, WhatsApp, telephone for sensitive material, keep encouraging them to do things that bring them pleasure. Get them to do some new things. I don't know who's round about your loved one. If they're in a shared accommodation, it might be possible to get them to try some quizzes or games of some kind. Anything to beat the boredom, tidy the place up. Get them linked into a virtual community. Some of these are available, or use call lines as required. Now, if your loved one is locked down with you at home, it is a slightly different challenge, and there is the potential risk that you get under each other's feet and there's not enough space, and it actually might become a situation where there's an increase in expressed emotion. And that might mean that you find yourself doing everything for your loved one and being too focused on them, or start to get a bit critical of them and trying to encourage them a bit too much. So we've got to look out for that if we're locked down together, and use the techniques which have been given in this webinar to make progress. Voices, as we've mentioned, can and often do reflect what is going on in society. Now, what the voices are usually talking about is the person's history. They're talking about themes from their background. They may be talking about low self-esteem, might be talking about bullying. There's a variety of things in there. But getting mixed in with that stuff is the current themes about the virus. So it's important to help the voice hearer realize that the voices are a signal that things have gone wrong in the past, and maybe that something's difficult just now, but it's just a signal. The voices have no more meaning than that. And so we can work with the themes within the signal. For example, the coronavirus, the more we talk about that and discuss it and decatastrophize it, the less the voices can talk catastrophically about it. If they've written the voices down, we mentioned that earlier, they may have realized, once you write it down, you realize, wait a minute, these voices just don't always get it right. And in fact, when I think about my thoughts, they don't always get it right either. I can start to become more logical in my thinking, more balanced. get my behavior more organized. And as we do that as a family, we find that things improve, the emotional tone improves, we do more things together more successfully, and the psychosis starts to retreat. So everything in this webinar has been about working with the stresses and the emotional and behavioral impact of the coronavirus. And I hope you found maybe even just one or two small things that might be appropriate for your family and your loved one. So that's all I'm going to say in this webinar.
Thank you, Douglas. It was wonderful. Really good to hear. Inspirational. I just have one question for you, because we had in Oslo University Hospital, there has been they have asked some of the patients about how they felt about this situation, and many were, frightened that they should be the reason why someone got ill, that they would transfer the virus in some way or another. So really scared for the families, and also to be contaminated by other people. So do you have an experience with how the family could cope with this fear of being ill themselves, or someone they love should be sick? Or
I think that is a very deep question. It goes right to the heart of the survival of the family. And it is uncertain because for a long time we've not really known, could you catch the virus off a letter or a parcel? People come to your door and they bring you parcels, and you're thinking, can I catch it? I don't actually know that. And even now, I'm not completely sure about that. So this is about being uncertain. So I think it's about acknowledging the uncertainty and coming up with the best rules we can. So I think we need to say to the person with the psychosis, who's got voices saying certain things, who are taking things personally anyway, because that's a typical paranoid style. This is what we know about this virus. This is what we know about how you can get it. This is the clear advice that we have.
Yes.
So it seems to be spread mostly through droplets. So if you are really worried about passing it on that way, you can wear a mask.
Yes.
I mean, it depends. Obviously, if they're at home, they're not going to do that. But if you're going to go out, you can wear a mask. That is safe and reasonable. Because they were arguing you should sneeze into your clothes or something, but a mask is reasonable. Try and do your social distancing, stick to those rules. So very, very clear rules about, then there's hand washing rules. So I think we've got to list them for everybody. And as they get updated, we say to the loved one, we will update this for you. Anything else that comes on in the news, you don't have to worry about it. We will come to you and tell you day by day what the rules are. And if the early symptoms do appear in MD, we will immediately take the appropriate step. But they're voicing a fear we all have, and I think we have to share that. And I think if it crosses over into psychosis, that is slightly different. We can work with that in a different way. But otherwise, it's acknowledging we all have it. And that is about anxiety again, isn't that? Was the first emotional problem in the webinar. And we can use all those anxiety-based approaches. For example, almost everyone that gets it get a mild version.
Yes,
it only is fatal in about 2%. So all of those classic rational responses, behavioral approaches, they can all be used. But I think the uncertainty is reduced by very clear guidelines.
Yeah, doing what you should do according to the guidelines.
Yeah.
Yes.
And they will change, but we'll be responsible for telling you the minute they change.
Yes.
I think that's the best we can do.
I think that's very good, actually. So thank you, Douglas. Thank you. I hope this will help someone.
Thank you, Kirsten. And it's great to speak to all my friends and the families in Norway.
That's good. Thank you. Bye-bye.
Bye-bye for now.